When we picture heart disease, we usually imagine it as a condition of old age, a lifetime of plaque buildup or worn-out arteries catching up with someone in their late 60s. But there is a lethal cardiac condition that primarily hunts in much younger demographics. It's the most commonly acquired heart disease for people under 25. This heat map charts the sheer scale of the crisis. Right now, an estimated 55 million people worldwide are living with this condition. It claims roughly 360,000 lives every single year, with the highest concentrations found across sub-Saharan Africa, the Middle East, Asia, and the Pacific. The danger spikes dramatically for pregnant women in these endemic regions. As a mother's blood volume naturally increases during pregnancy to support the baby, that extra fluid puts tremendous, and sometimes fatal, pressure on an already compromised heart. This is rheumatic heart disease, a condition born from common bacteria rather than rare genetics. The entire lethal cascade begins with something incredibly mundane, a standard, easily transmissible strep throat infection. That is the quiet tragedy of this disease. A highly common, everyday childhood illness that most families brush off can slowly and permanently destroy a child's heart if left unchecked. The trigger is a bacterium known as Group A Streptococcus. Like most upper respiratory infections, it passes easily from person to person. Because of this, it thrives in marginalized communities where poverty dictates overcrowded living spaces and poor housing conditions. In well-resourced areas, a doctor prescribes a quick course of antibiotics and the bacteria dies. But when families lack the time, money, or awareness to access basic clinical care, the infection is left alone. Left untreated, the body mounts its own defense. But in a subset of people, that defensive response misfires. The immune system becomes confused by the strep bacteria and begins attacking the body's own healthy tissues instead. This intense autoimmune reaction is known as rheumatic fever. It rips through the body, causing painful, migrating joint inflammation, severe rashes, and jerky, uncontrollable physical movements known as chorea. The inflammation doesn't stop at the joints or the skin. It travels to the heart itself, inflaming the delicate valves that control blood flow. As the inflammation eventually subsides, it leaves behind dense scar tissue, turning previously flexible valves stiff and rigid. Because they are scarred, the valves fail to seal correctly with each heartbeat. Blood backflows into the chambers. To compensate, the heart works harder, leading to noticeable murmurs, severe fluid swelling in the limbs, and ultimately complete heart failure. At this stage, the biological damage is done, and it is entirely mechanical. You cannot medicate away a heavily scarred, rigid valve. The only viable cure is open heart surgery to physically repair or replace the damaged parts. For a patient in a low-income country, this surgical requirement is a virtual death sentence. Complex cardiothoracic surgery is either entirely unavailable in these health systems, or the out-of-pocket costs will completely bankrupt the patient's family. The true devastation of rheumatic heart disease is that the biological self-destruction could have been stopped. The failure lies within the broader healthcare safety net, which often misses a basic throat infection before it turns into permanent cardiac ruin. Because the late-stage disease is incurable without surgery, the medical focus shifts to extreme secondary prevention. If a child survives their first bout of rheumatic fever, they have to be chemically shielded from ever catching strep again, because a second infection would completely destroy whatever valve function they have left. The strategy for this is grueling. It requires deep, painful intramuscular injections of an antibiotic called benzathine penicillin G, and this injection must happen every 3 to 4 weeks, consistently, for many years. Enforcing a relentless multi-year injection schedule is an incredibly steep logistical hurdle. Patients often live in remote, rural, or indigenous communities, making it difficult and costly to travel to a clinic every single month. And even when they do make the trip, the drug might not be there. The global medical system frequently runs out of benzathine penicillin G, and the reason is deeply ironic. Shortages occur because the drug is so old and so cheap. Manufacturing this specific formulation is technically demanding. But because it's a decades-old generic drug, the global purchase price is kept extremely low. This creates a tiny profit margin, pushing pharmaceutical companies to abandon production entirely in favor of more lucrative medicines. This global market failure prompted the World Health Organization to step in. They have issued new, coordinated guidelines for diagnosis and have passed resolutions to actively manage and secure the global supply chain for this specific, life-saving antibiotic. Eradicating rheumatic heart disease requires a multi-front assault, lifting housing standards, reducing poverty, and treating essential medicines as an unbreakable global right rather than a low-margin commodity.